congratulations, Dr. Sukhesh. We have with us Dr. Sukhes Mukherjee, who is an additional professor in the Department of Biochemistry at AIIMS Bhopal. With 17 years of teaching and research experience, he has published over 104 papers in peer-reviewed journals and presented at numerous national and international conferences. Dr. Mukherjee's accolades include the Best Paper Award from the Association of Clinical Biochemists of India and the International Travel Fellowships to attend prestigious conferences. He is a fellow of the Linnean Society, a National Academy of Medical Sciences India member, and the Royal Society of Biology UK. So congratulations, Dr. Sukhesh, for receiving the BlackBuck Award for medical research. And Medical Dialogues basically aims to highlight such research. So if you could just give out a message, or how do you feel if you could just give out your words on that?
It's a great honor to be here, and Medical Dialogues being the largest community among the medical professionals and on the medical colleges, and we being at AIIMS always follow the things both in the research and other aspects. So it is really an honor, because integrating research with the clinical practice is the most important key and successful of this conference. And with the eminent panel discussions and other things, really it will be helpful for all the budding researchers, clinicians, as well as those who intend to do good things will come under a similar platform. And since it is being live telecast throughout all the members of the community, it will boost them up in the coming years with a successful solution. That will be a great achievement for as well as the medical dialogues, as well as the clinicians and the researchers who are following this journey.
Great, that's definitely a key lead. I would say that it's basically integrating practice with research. Any message that you would want to give out to young professionals?
Yeah. Actually, to give the integrity, we based on 4 I's. Either in clinical practice or research. 4 I's based on: first is your intention, second is your intuition, third is your integrity, and last is your intervention. Because without these 4 I's, you cannot be success either as a clinician or a researcher or your commitment to other society. And these interventions actually now being focused on 2 or 3 parts, which is coming in the good names of precision medicine, translation medicine, clinical aspects of research, and delivering to the community. These 4 things are key to the government also, a mandate also, and also for the key professionals who are doing clinical practice and research. These 4 I are the landmark of the things, and I hope the young researchers to follow, and those who are doing the things will be making these 4 I a massive success. That's the important part.
And lastly, sir, if you could just highlight a little bit about your research.
In AIIMS Bhopal, my work is on basically on the cancer biology, on the breast cancer, and in last 3 or 4 months, our work was being actually cited in India. It came in NDTV and other news channels, where we are showing that not only the drugs, the cardiotoxic drugs can be reduced by the natural taking things. And actually, we are working on the Moringa polyphera. What is this Moringa polyphera is actually in the Hindi what is called is the munga. And there, when you isolate the things, it can be a very good thing which is anti-metastatic in effect. And this work actually giving us a lot of accolades. In my student was awarded the best paper in 2009 in one of the international conference. So we are working on that. And lastly, actually to highlight our one more research which is very important, pertinent to the community. I was here actually up to 26 in Delhi, that our Indian government and ICMR is working on the task force for coming up with a reference interval for Indian population, which is a very pioneering study and a very new concept which our government is very interested on us. We have 15 centers and we are a brainstorming session where actually these things should come out. Reference level for all the Indian population. It's not the diabetic what we are following the Western or the American population. We should have our own reference level. So this is another project we are working, and I was actually up to last week was in ICMR with the meetings to how to come out with a solution, because we have to give this data to the policymaker, and this policy what usually come out in white paper should actually benefit in the community. So the misuse of the drug, what sir was taking, the misuse of the drug, the pharmacovigilance, and what is the drug adverse drug reaction, that should be reduced in the Indian community, because that is creating more and other issues which should be avoided. So these are the 2 areas which I am focused on, and hopefully we will come out with a solution in the coming years if we can continue with this aspect and this tempo.
Congratulations once again, and thank you for joining us at Medical Dialogues here.
Thank you very much, and I hope that all the meetings should be a grand success with the eminent and galaxy of all the academicians, researchers and clinicians all over the countries. And also, again, I thank Medical Dialogues for taking the initiative of doing such a conference where the conglomeration of all the important persons throughout India, also absent persons from abroad, joining in this gathering. Thank you, ma'am.